Great, thank you, Blair. Good afternoon. Thank you all for coming. As you all know, my name is Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Today I'm here to give an update on COVID-19 and announce that 10 new cases have been confirmed, bringing the total number of cases in the province to 39. 6 of the new cases are in the Calgary zone and 4 are in Edmonton zone. 2 of the new cases, 1 in Edmonton and 1 in Calgary, have been admitted into intensive care. All of the others are self-isolating at home and expected to make a full recovery. 8 of these cases have been confirmed to be related to international travel or previous confirmed cases. Travel histories include a dental conference in Vancouver, Las Vegas, Switzerland, Germany, Spain, and Pakistan. Investigations are ongoing on the remaining 2 cases. I know many Albertans may be alarmed at the increasing number of cases in Alberta. As I've said before, we need to get used to a new normal. The reality is that we can expect cases of COVID-19 to continue in Alberta and around Canada for months. We have taken aggressive measures to limit the acceleration of spread, but we will not be able to completely stop it. I want to emphasize that we cannot be complacent. We must be vigilant. And we must look out for each other by practicing good hygiene and employing other preventive measures such as social distancing where appropriate. The most important thing that I want Albertans to do is to stay home when feeling sick. Even if you have not traveled, if you have symptoms of cough or even mild cold-like symptoms, you need to stay home and away from others. This is critically important. Although most of those cases would not be COVID-19, we want to make sure that we're all practicing the new normal, which is not being out in public when sick. We are continuing to closely monitor the situation in Alberta and the rest of Canada, and we will take additional steps as necessary. When it comes to protecting the health of Albertans, we will continue to consider all options. If we are to be successful in preventing the spread, we will also need your help. First, I want to emphasize the importance of following all public health guidance for travel. Travel outside Canada is not recommended at this time. We also ask that any travellers returning from outside of Canada after March 12th self-isolate for 14 days after their arrival in Canada. Monitor for symptoms, and should they occur, please complete the online self-assessment tool at the Alberta Health Services website. I would like to return to my comments yesterday about schools and the decision to keep schools open at this time. I understand that parents are concerned about their children going to school, and they, along with teachers, school administrators, and boards, have questions and concerns. I cannot emphasize enough the time and discussion that continues about this decision. If we do make the decision to close schools, it will be considering long-term closure. This pandemic will not end in a matter of weeks, and there won't be a clear opportunity to reopen schools, likely not until September at the earliest. I appreciate that each province is considering its own approach to school closures, and this varies considerably at this time. A few provinces have determined to close schools. However, we have also seen other jurisdictions, such as Singapore, be successful in preventing the spread of COVID-19 without having to close schools. I am carefully monitoring Alberta's situation on a minute-by-minute basis. I am prepared to consider all options, including directing the closure of an individual school, a group of schools, a school division, or all in the province if the situation warrants it. In the meantime, we will continue to work with schools, who remain a critical frontline partner in helping limit the spread of COVID-19 and other viruses, in educating our children on the importance of good hygiene practices. Earlier today, I had a productive meeting with representatives from Alberta's school boards, school authorities, and education stakeholders to explore ways we can equip them to adjust operations in response to COVID-19. We have shared a new guideline to help schools and childcare centres prevent the spread of COVID-19. This guideline is also available online. I have already taken feedback from my meeting this morning, and Alberta Health is revising the guideline to address what we heard. We will continue to assess the situation and work with schools to determine if any additional steps are needed, depending on the situation in the province. One change we are making to announcing exposure locations starting today is that we will be posting the flight information for any flight or portion of a flight where passengers may have been exposed to COVID-19. We are focusing our public health follow-up on local confirmed cases and contacts and will not be directly contacting Albertans who are on these flights. We are asking for Albertans to help us by checking this information. Online flight information includes the flight number, date, and any seats that might be at risk of exposure to COVID-19. At-risk passengers are encouraged to self-isolate and monitor for symptoms for 14 days after arrival in Canada. Other passengers are not required to self-isolate, but should monitor for symptoms as a precaution. Given the rapid spread of COVID-19, we are seeing more and more flights with passengers confirmed to have the virus. If you have recently returned to Alberta by air, I strongly encourage you to visit the Alberta government website and self-isolate if you are found to be at risk of exposure based on the information online. Before I conclude, I would like to mention a change in our daily reporting. Given the number of cases daily, we will be reporting more aggregated data online going forward. We will continue to notify you if there are exceptional circumstances, such as a case involving a high-risk individual. However, this change to aggregate reporting will help our surveillance and testing teams to focus their effort where it matters most. Finally, I would like to thank Albertans for their uptake of the self-assessment tool we announced yesterday. In the span of 24 hours, we have seen well over 300,000 Albertans complete self-assessments. By using the self-assessment tool, you have helped to ease the pressure on HealthLink 811 phone lines. Thank you to everyone for doing their part, big or small, to help us keep Albertans safe and healthy. The health of Albertans is and always will be our top priority. Thank you, and I will now take any questions you may have.
Great, thanks.
Can you speak to the number of Albertans who have recovered, or are we still just counting infected? Is it too soon for that?
So by recovered, the definition that has been adopted by the Public Health Agency of Canada that we're currently following is someone who has 2 negative swabs for COVID 24 hours apart, and we don't yet have anyone who has met that definition of having those negative swabs. And so I guess I would remind everyone that it really is only just over a week ago that we had our first case, so we continue to monitor, and when those numbers start coming in, we will report those as well.
What are the ages of the 2 intensive care cases?
The 2 individuals in intensive care are both in their 60s.
Okay. Just to clarify, of the 10 new cases, 8 are travel related and 2 you don't know. So that doesn't necessarily mean that it was a community spread. You just haven't.
So that's what we're currently investigating, is exactly that question. If there is a travel-related connection that we haven't yet identified, or that question of community spread, which of course would be significant, but that's what the public health investigation is currently looking at.
Yeah, follow-up. You said you're switching to aggregate reporting. Can you explain a little bit what that means?
Sure. So previously in our daily briefings, we've given you specifics about every new case, where they're from, what their age is, what their gender is. And that's proving to be more and more challenging as we end up having new cases to try to make sure that we're aligning each of those cases for our public reporting. We have it in aggregate form. We know in kind of overall how many cases we have in each age group, overall how many cases we have in each zone. But to separate that out so we know case number X was, this age, this gender, this zone. The local teams have all that, but at the provincial level, it doesn't really change the risk level for the public in terms of knowing individual cases and those age and gender pieces. So we're still reporting that information. It's just going to be reported in a collective way rather than an individual way for the new cases going forward.
Okay, we'll do one more here and then we'll take a call on the phone.
Can you share a little more about what your guidelines would be for those schools and daycares? What's going to change come Monday when all the kids are going back to school?
Sure. So the guidelines are actually posted online, I believe. So you can go to our website and there's information for schools, so you can see the guidelines there. The most important part of the guideline, the foundation of the response, the foundation of the school safety protocol, is a zero tolerance policy for anyone with cold-like symptoms, cough, fever. So I know schools typically have children with fever sent home. But what we're wanting to emphasize to parents and to guardians, to teachers and staff is that going forward, there will be zero tolerance. So any child who has symptoms, and again, this would be for daycare and schools, will be asked to not come to school. And if a child develops any of those symptoms at school, they will be immediately isolated in a room away from other children, and the parent or guardian will be asked to come and pick them up. And again, this is one of the most critical pieces, is making sure that we're following that policy, that if anyone does develop those symptoms, they're kept away from others, even though, again, the likelihood of an individual case being COVID is small. Across the province, we need to make sure that everyone is following this advice as we see our case counts rising, because this is the new normal that we need to follow.
Operator, can you please patch through the first call?
Our first question comes from James Keller of the Globe and Mail. Your line is open.
Hi, Dr. Hinshaw. What can you tell us about the availability of ventilators in the province right now and your ability to scale that up if this escalates and we need more?
So what I can tell you is that many weeks ago when we saw the issue of COVID starting to escalate, certainly in China and then some other places around the world, Alberta Health Services was doing advanced planning, and so they did make sure to enhance their ventilator capacity at that time with an additional 50 ventilators. I can't comment at this moment what their total ventilator capacity is, but that's something that we could commit to getting back to you on. So that's what I can share at this time.
Great. And have you done any kind of sort of assessments or projections as to what the need might be, best case scenario, worst case scenario, if the outbreak escalates?
So one of the really important things to understand about the approach that we're taking is the problems with acute care capacity would be greatest if we have uncontained spread of the virus. And I'm sure many of you have seen online a graph that shows a steep rise in the curve of new cases, followed by kind of a steep downslope. And that would represent, that shape of that curve would represent spread of the virus in the community that we were not stopping in any way. And what we're trying to do with our measures is to take the top of that curve and push it down, calling flatten the curve, to spread out the cases over time. The reason that's important to your question is that the most important determination of whether or not we have adequate capacity in our acute care centres is not the total number of cases that we see over the entire outbreak. It's the time span in which those cases come. So with our containment measures, what we're trying to do is limit the acceleration of spread, push that curve down, and try to contain the spread as much as possible and kind of a low level, kind of low shaped curve. So I think really, again, the capacity issue is what we're trying to mitigate by making sure that our containment measures reduce the volume of spread and spread out the time over which we see new cases.
Okay. We'll take one more from the phone and then we'll come back to the floor. Go ahead, operator.
Our next question comes from Chris F. of CTV Calgary. Your line is open.
Dr. Hinshaw, at any given time, I would suggest a quarter to half the kids in a school, especially elementary school, have sniffles, have a cough, sneezing, something like that. Is this going to be manageable to leave this up to whether it's teachers or parents to determine if this is something to be sent home? Because if we have a sense where teachers are asked to pull aside kids who have asthma, a cough from something else, a one-off sneeze, is this really going to work?
So that's exactly the question that I posed to school administrators in the meeting that I had this morning. And we are looking for their feedback on that. I understand, I've mentioned before, I have elementary age children myself, and so I do know that it can be challenging, especially given that we are in winter season and there are other viruses that are circulating. And so I think we're waiting for feedback from school administrators. This morning, we didn't hear anyone say that it was not possible. Again, we're still waiting to hear, so I think it's premature to say that. But I do think that what we're asking is for parents who know their children best to assess them before sending them to school. We're asking parents to help us because, again, this is an effort that will only be successful if all Albertans pitch in and make sure that we're taking responsibility when we or our family members are feeling sick, that they do not go out in public. So again, I think parents are really best positioned to make that assessment if their child is unwell. And then the school would be a backup to that, again, making those assessments. And so, again, we're waiting for feedback from administrators, but at this time, that's one measure. And then there's other measures in that document with respect to regular cleaning, hand hygiene for students, trying to implement some social distancing so children perhaps have desks that are spaced a little bit further apart than normal. And so you can read other details in the document. But again, recognizing we are waiting for some feedback from administrators on that particular point. But this would be the cornerstone, again, is making sure that no sick children are in school.
And just to clarify, you're saying if Alberta closes its K-12s, it's likely they'll be closed until the fall?
What we know is that evidence around the effectiveness of school closures as a means to mitigate spread indicates that closures need to go on for about 8 to 12 weeks. And what I believe we will see going forward, again, I believe we will continue to see new cases. So if we do choose to close schools, given evolving situations, if we believe that the risk is high enough to require that, I don't believe that that risk in terms of the spread in the community will reduce substantially within a matter of weeks. I think we would be looking at school closures to the end of the school year.
Great. Yeah.
So I know a lot of people who took that assessment online, and people especially who have shortness of breath, they usually are asked to call 811. But we're hearing from a lot of people that there's still such a backlog on calls, even in the middle of the night. Is there anything outside of the online assessment that you are kind of offering or working on for people to connect?
So the self-assessment tool right now is the first phase. One of the next phases that's being worked on is the opportunity for people who've worked their way through that tool to then book an appointment online as well without having to call 811. So this is the preliminary pilot to determine that screening and to kind of align with whether or not the screening is accurate and correct when people actually talk to 811. But we are looking at that future state where people might be able to use that tool to actually book that assessment center appointment, which I think would help a lot with the backlog.
Okay, we'll do gentleman in the second row and then gentleman in the first row.
Is it at all, I don't know if the word is noteworthy to you, but we have almost 40 cases and still no confirmed cases of community spread. I mean, that seems like the better of the two alternatives, obviously. I mean, does that strike you in any particular way?
So community spread is something that we're very mindful of, that the numbers that we have simply indicate what we know about. And again, as I mentioned, these two cases that we have today are ones that we're really aggressively investigating because it does raise the concern that these may be indicative of community spread. We know that in provinces like British Columbia, even though they've had a few cases of community spread, they have been able to put measures around to help with containment. But again, the situation is changing dramatically and rapidly every day. So I just think part of what my message is as we see our numbers increasing, even though the majority are travel related, I think it does emphasize that we will continue to see imported cases and cases that perhaps haven't self-isolated when they're sick, resulting in some spread among their close contacts. And so we can't take for granted that if someone hasn't traveled, they automatically are immune from having COVID. Again, I believe it to be rare at this point, but we need to be prepared that we could see community spread. And we need to make sure, again, that every Albertan, this is not something that the health system or any other system can do alone. This is something that every Albertan needs to be a part of to make sure that we're collectively managing to reduce the spread to others.
Is there any guideline for the grocery stores?
So at this point, we haven't made specific recommendations to grocery stores with respect to, for example, the number of people that can be in them at any time. I know grocery stores have been making hand sanitizer available or wipes available for carts, and those are the kinds of things that we would recommend, whether it's a grocery store or another setting where you have people coming and going, would be to have more frequent cleaning of surfaces that people are touching regularly, for example, the handles of shopping carts, and also to post signs. So we really recommend that any location, business, school, anywhere else, we do have signs available on the Government of Alberta website to remind people at that point of entry that if they're sick, they should not enter, they should go home. Again, trying to get that word out that we are all a part of this response And I know that it's inconvenient for people to have to stay home when they're feeling ill, but this is about protecting our loved ones, protecting the people that we love who are older, protecting the people we love who have chronic health conditions. So again, we are offering some of those guidelines, some of those resources to stores, and encouraging all Albertans to be a part of this response.
Great. Go ahead.
Are your children still going to school? And what factors would lead to you keeping them home?
So my children are still going to school, and if I felt that it wasn't safe, I would not make that decision for my own children. I would make that decision for the population, because I don't differentiate in terms of, I would never make a decision for my own children that was different for what I felt was necessary for the whole population.
Okay, go ahead.
So people who have weak immune systems who are waiting on those wait times, is there anything like separate for them to kind of help those really high-risk cases?
When you say wait times, do you mean the HealthLink wait times?
HealthLink, yes.
So unfortunately, we don't have any kind of different access for different groups of people. We are working, as you've heard, to try to decrease those wait times. Sounds like you've heard anecdotes of people maybe calling in the middle of the night and still having long wait times. But Alberta Health Services is trying to expand staffing, as well as moving to have this tool be able to book appointments online. So unfortunately, again, I know it's frustrating, I know it's challenging, and all I can say is at the moment we're trying multiple options to try to reduce that. And knowing that in the meantime, while Albertans are waiting for assessment, the really critical thing is if they're ill, they do need to stay home. And one other thing I should mention, I think there's also maybe some confusion around people who are feeling completely well. So I want to be really clear that if someone is completely well and they have no symptoms, they do not need to be tested. We are not testing people who are well. Testing is only for people who are sick.
Okay. We've got 2 questions online. I'll take those, and then we'll come back to the floor. Operator, can you patch through the first question, please?
Our next question comes from Alex of Chat TV News. Your line is open.
Of individuals gathering. 250 is the standard right now, but what are the mitigating factors for those gatherings below that number, such as if they've traveled internationally, if they're traveling within the province, and they've met with a lot of people? I mean, for groups of, let's say, about 100 who are in that kind of category, should they be meeting in large groups like that?
So our recommendation is that any groups over 50, if those groups involve people who've traveled internationally within the last 14 days, if they involve people who would be at high risk of serious health complications, such as seniors, or if they're members of critical infrastructure groups, such as healthcare workers, we would recommend that they not have any gatherings over the size of 50. And if there are no high-risk factors like those, gatherings between 50 and 250 with measures like social distancing, ensuring appropriate hand sanitizer, and again, critically, if there's anyone who's ill at a public gathering, they should be asked to leave. Again, those signs need to be posted on every door, and reminding people that this is sort of a social responsibility that we all have to protect each other. If we're feeling sick, we should be staying home. So those are the kinds of measures, again, for between 50 and 250. But any of those high-risk categories I mentioned, they should not be proceeding with their events.
Okay, unfortunately, thanks. I think that's all we have time for today. We'll be here again tomorrow at 3:30 to provide a further update. Great, thank you.